there, Tammy. My name is Sabrina. I'm the nursing student. I'm here just to talk to you a little bit about Kawasaki's disease. Is that okay with you?
Sure.
Okay. I'm going to just check Timmy's wristband here quickly. My verifications there. Perfect. Is it okay if I pull up a chair next to you?
Sure.
Okay. All right. So I know Timmy's been here a few days with us, and he's definitely improving, so that's wonderful. So I just wanted to go over Kawasaki's disease with you so you fully understood what was going on. Okay. So Kawasaki's disease, what is it? So this is an illness that affects the blood vessels to your heart and can cause them to become inflamed. Those vessels are called the coronary arteries. They're the vessels that are going to give your heart oxygen and blood. So it's really important. So when they become inflamed, we definitely have concerns. Okay. So what causes Kawasaki's disease? This is actually unknown at this point. It's believed either to be a genetic link or a virus, but there's no actual definite cause that's known. Okay. Who's affected by this? Most commonly, we're going to see children between the age of 6 months and 5 years, which we know Timmy's 2, so he fits right into that age group, okay? It is more common in boys than girls. And then we do see it more commonly in children of Asian or Pacific descent. So I don't know if there's any heritage there.
Yeah. Timmy's father is Asian.
Oh, okay. So that we do see that. So the symptoms of Kawasaki's disease. So we're going to see this actually in 3 different phases. Okay. So phase 1 is what we saw when Timmy first came in. So we had that high fever of over 101 when he came in. That persisted for more than 5 days, and you were giving a fever reducer, and it was not doing anything. Mm-hmm. That is one of the very first signs we're going to look for. Okay. Other things we did see, he had the rash on his hands and feet. He had the swollen glands, most commonly in the neck, which we did see as well. His eyes were a little red and puffy as well. That swollen bright red tongue, that's called strawberry tongue. And we did see that as well when he came in. He had the inflamed throat, mouth, and lips. So those are all signs that point towards Kawasaki's disease. Going into phase 2, which we saw a little bit later, includes the joint pain he was having, some abdominal pain. Thankfully, we didn't have any vomiting or diarrhea, but he could have. And you'll probably start to see soon the peeling of his hands and feet, the skin. Okay. And we're working our way into the 3rd phase, which is when the symptoms start to go away. This phase can take as long as 8 weeks. Okay? So how did we diagnose Kawasaki's disease? So like we know, the doctor came in. The first step was we did that assessment. Listened to heart, lungs, all of that. Then we moved into doing some diagnostics. For that, we did an echocardiogram. So that's the machine that looked like an ultrasound. That was it was a picture of the valves and the heart structures. Okay? And then we also hooked him up to those little electrodes he has on his chest for an EKG, an electrocardiogram. That was looking at the rhythm of the heart and how it was beating. Okay? And then lastly, we did run some blood and urine tests. That was to rule out other diseases. Okay. Mm-hmm. So we did the assessment, we did our diagnostics. So leading into what is the plan? What is our goal for treatment? With Kawasaki's disease, the goal is to reduce that inflammation of those coronary arteries. Okay. So how are we going to treat this? What is our plan? Well, while he's been here so far, we've been doing everything we can to keep him comfortable, keep him quiet. We've been doing his vital signs, giving him his medications and all that. So the treatment plan that we have for Timmy is we're going to go ahead and give him, it's called IgIV. So this is an immune globulin. So what is an immune globulin? It's an antibody that we're giving him. Antibodies, it's a blood protein that fights the foreign substances in the body. Okay, so this is going to fight to help him get better. So we're giving that to him currently, and we've been giving him aspirin, which is to reduce the inflammation. Most commonly, you'll be continuing that aspirin regimen for quite a while when you go home based on the doctor's order. Okay. So some of the complications. with Kawasaki's disease if not treated right away. Thankfully, you brought him in. We're doing everything we can, but these are just other things to be aware of. Patients can develop an aneurysm of those coronary arteries. What an aneurysm is when the vessel becomes weakened in the walls, and then blood will pool there. Okay, but we're not seeing any of that with the echocardiogram with Timmy. They can develop inflammation of the heart muscles and other structures. They can develop an abnormal heartbeat, which is called an arrhythmia.
Okay.
And then they can have problems with the heart valves develop, had this not been caught and been treated. Okay, so going home, what we're going to have you do, you're going to continue with the medications. Like I said, probably an aspirin regimen. Okay, I'm going to have you check his temperature every day for the next 3 days. If he develops a fever, we want to know. Okay, we're going to be balancing the activities with rest to prevent fatigue. Encouraging those rest and quiet periods. It's very important that you keep Timmy from here on out up to date on his flu vaccine to prevent other illness. Okay. When to call the doctor. So if you start to see him have the flu or the chicken pox, we would want to know. Okay. So aspirin toxicity, with him going home on that regimen, that is definitely one of our concerns. So I did list here a list of those signs, which include headache, confusion, dizziness, and ringing of the ears. Okay. And again, I had said the fever. So if a fever over 100.4 degrees, we want you to give us a phone call. Okay.
Mm-hmm.
And then things to expect afterwards, once you've been home. It's very common. We're going to be reperforming that echocardiogram at 2 weeks, 6 weeks, and then again at 12 months. So Kawasaki's disease, because it is inflammation of those coronary arteries, the big concern is long-lasting effects to the heart. So that's what we're going to be monitoring with those echocardiograms. One of the big things to watch for is he can be very irritable. This is very common with Kawasaki's disease and can last for up to 2 months afterwards. Okay? And then we're going to have you be following up with a cardiologist as well. Okay, here's some more informational places you can go to find information about Kawasaki's disease. Okay, any questions I can answer for you, Tammy?
No, this was very helpful. Thank you.
Good. And I'm going to send this home with you. But if you have any questions, please give us a call, and we will definitely take the time to talk to you. Okay.
Okay. Thank
And
you.
yeah, looks like
Thank
Timmy
you.
should be going home hopefully tomorrow then. Okay.
Good.
Perfect. Okay,
Thank you
Tammy.
very much.
You're welcome.